Welcome, everyone, and thank you for attending this session today. We all know the importance of diagnostics. That's why we're here, and we know that $1 invested in diagnostics returns about $24 on your return on investment. So it's important to have these discussions, and again, thank you for being here today. The WHA has brought a lot of excitement around diagnostics, and today I've spoken to many people, and I'm asking everyone I speak to if you could sum up this year's WHA in one word, what would it be? And surprisingly, I would say about 9 out of 10 people, what's their one word? Starts with a D. Diagnostics. So I think this discussion is very timely, and I just want to thank Dr. Randu for coming here and having this little fireside chat with us today. So I guess we can get into the discussion questions. So why is early diagnosis and linkage to care so critical, not only for patients but for health systems in general? And before we start, just if you have questions or comments, we sort of want to make this as informal as possible when two people have microphones in a large room. So feel free to jump in.
All right. Thanks, Alexandra. And just to say, I lost my voice for 2 days, and today is like the first day that I've gotten it back. I don't always sound this sexy, but yeah. So just gonna, please bear with me. I hope you can hear me all right. But I'm just really grateful to Fine for inviting me. And like you said, GLIDE, our full name is the Global Institute for Disease Elimination. We're based in Abu Dhabi, and we got started in 2019. And our whole kind of mantra is to be a catalyst towards elimination for neglected tropical diseases, but also just to build a health system that can reach the most marginalized people as far as possible. So to answer your question about why diagnostics are important at the patient and health system level, I mean, I think throughout the day you all have heard how important it is for patients to have early diagnosis. First there's a higher likelihood that whatever ailment they're suffering from can be cured, but also, when it comes to infectious diseases, you're able to break transmission chains the earlier that you get to the patient. Yeah, and I think, what's interesting, I'm glad that you said 9 out of 10 people here said diagnostics.
It's true.
It's very surprising to me, because I think the reason FIND exists is because diagnostics often are, forgotten, which makes really no sense. I was at a roundtable yesterday, and a pharmaceutical executive said, we talk about treatment all the time, but if you can't diagnose something, you can't treat something. And that's really true, and yet we have this diagnostic gap.
Pharmaceutical executive or
Yeah.
diagnostics executive?
They do treatment, like they don't do diagnostics. So that was encouraging. And it's important whether we're talking about chronic disease or infectious diseases. Early diagnosis and treatment in malaria, for example, will break transmission, will ensure that the human isn't transmitting it back to the mosquito. And HIV, early diagnosis has been shown to kind of optimize the benefits of antiretroviral treatment. So longer life, less likelihood of the HIV going to AIDS. And so, yeah, diagnosis is very important for the patient. As an ex-field epidemiologist, disease surveillance guru, diagnostics was our guiding lamp. From COVID, everybody knows you have like all these suspected cases, and until you start really having confirmed cases, you're kind of still in the dark. You need a path for the response, and diagnostics gives you the steps to go. And I think COVID-19 really kind of opened that up to all of us, right? We were in the dark before we had PCR, but I think self-testing took it to a whole nother level, right? So PCR was important for surveillance, us understanding where COVID-19 was, who it was affecting, who was dying, who was recovering. But I know self-testing for me, and I'm sure for a lot of people in the room, it helped us to make informed decisions, right? Should I go to that party? Should I not go to that party? Should my kid go to school? It gave us a lot of power. So I think,
Yes, he should go to school.
You should go to school.
Absolutely,
Yeah.
he should. It was a long
most of the
confinement.
time. Yeah. So, yeah, completely agree. So, diagnostics gives us precise, accurate information to make decisions.
Absolutely, and I think as we get closer and closer to the patient with diagnostics, so really true point of care diagnostics, shifting away from the central to the more decentralized tools that we can use, there's more opportunity to diagnose earlier and to get people into care. So it's interesting the different channels that are popping up and that are gaining importance pre-COVID, but post-COVID to pharmacy channels is a big piece of work that we're trying to explore to understand how we can leverage those existing channels and expand diagnostic testing and get much closer to the patients. But I wonder if we can put a spotlight more on neglected tropical diseases and talk maybe a little bit about the need for financing mechanisms, the need for more diagnosis and linkage to care.
Sure, yeah. So neglected tropical diseases, just going to give a quick summary for those of you who are not as familiar. It's a group of 20 diseases that WHO has categorized. And really what links these diseases together are that they're diseases of poverty. They impact the most, remote folks, the folks that have the least amount of resources and money. Most of them are debilitating or immobilizing, and they're neglected. And so that means they receive very little funding. And so within these 20 diseases, there's really just 2 of them that have a reliable diagnostic. There's 6 of them that have no diagnostic at all, and then the rest of them have some sort of diagnostic, but they could be improved according to the WHO NTD roadmap for 2030. And like I said earlier, these diseases really impact people that are far away. So when we talked earlier about the health system, diagnostics can actually bring the health system to people, right? And so if a lot of these diseases are stigmatizing, so people don't leave their homes and they're already quite far away from the health system. And so like a point of care diagnostic could really help them understand what they have. If treatment is available, they can be treated for that disease. And that's really not available for most neglected tropical diseases. Do you want me to talk about the innovative finance?
Yeah, maybe just to say that even when those point of care tests are available and are there, we're seeing challenges where there's a great test developed, but then there's no manufacturer that wants to manufacture it because guess what? There's no market and there's not a lot of willingness to pay for a rapid diagnostic test for HAT, for example. So it's how do you galvanize the right stakeholders and look at it from a creative or innovative investment case to be able to say that a milestone-based payment for elimination of HAT is worth it because you have a fixed timeline, you have treatments, you know what diagnostic you have, and it's just putting the pieces together to make that investment case and to put those ideas forward. So with that, maybe you can talk a little bit about the ideas that were proposed in the discussion paper and sort of the next steps, and then maybe if there's any questions or comments from the audience, we'd be happy to turn it over as well.
Sounds good. Yeah, so if you look across the value chain for neglected tropical diseases, so starting from research and development to access, there are so many gaps. Like you just said about diagnostics, I think 65% of the funding that goes to diagnostics for NTDs are just from five manufacturers. And like you said, there isn't an incentive really to produce this because while these are debilitating, the disability adjusted life years for NTDs is even more than TB. They don't have the same amount of prevalence. I mean, if you look at TB and malaria, like these affect less people, and the people are kind of spread out across countries, and so that market is really difficult to make money from or to even access sometimes. And so a group of us find Glide, some other PDPs and NGOs and pharmaceutical companies. We've been really kind of doing an intellectual exercise that started first with like a scoping of the gaps within that value chain. But then, at the end of that exercise, we talked about like what are some innovative finance instruments and mechanisms that could be applied to NTDs that were applied to other diseases in the past, so like malaria and TB. And we came out with we prioritized 4 different instruments. And just to say, we prioritize these. These are not the only instruments, but these are the ones that we thought, could be, at least we could start there. And that included debt swaps. You mentioned milestone and end-based prizes, which I think it could be particularly good for diagnostics. Debt swaps.
Pool procurement.
Yeah, pool procurement. So I was going to come to that. But development impact bonds, that's the one I wanted to say. Willow's just like telling me everything.
Impact bonds.
Right. Impact bonds and then pooled procurement. And I think pooled procurement is a really interesting case study because it really does, solve that issue of fragmentation and uncertainty when it comes to the demand. Also, we've been talking a lot about, well, everyone has been talking a lot about regionalization and local manufacturing. And so with pooled procurement, there's an opportunity to look at this at a regional level and use regional platforms to answer the needs for diagnostics.
And use that excess regional manufacturing capacity that's being built for the tests that affect the regions where the manufacturers are as well. So I think there's a lot of different pieces to really put together. I'm curious if there are any questions or comments from the group here. Yes, please.
I'm just wondering if you looked at the priority review voucher system in the US, because that's very backloaded, but I'm wondering if people are considering that for Europe and as a way of incentivizing more folks to do research into NTDs, because it sort of exists already and it is driving interest in new technologies as well.
Yeah, that was not one of the, I guess, tools or mechanisms that came up. Do you want to explain it a little bit more?
It's like, I think, my understanding is, I'm from DNDI, and my understanding is that in the US it's a system whereby public-private partnerships can happen to get priority for partners, industrial partners, to work with the public sector to be able to move their products more rapidly into being accepted on the marketplace, and that's of value to pharma companies, and it incentivizes them to put in-kind effort behind NTD research. And I think one of the ideas is to have a similar mechanism like that in Europe. So it's something that's tried and tested, but it's just sort of putting it in a different market.
It's definitely an interesting model, and there's been success stories with PRVs. I'm thinking of miltefosine, and I'm looking at DNDI colleagues here, where it was registered, and Knight Pharmaceuticals received a PRV that they then sold to Gilead on the market for $120 million, and that is a great way to incentivize innovation. But then what happens next, right? Can we get a batch of miltefosine produced when we need it? Can we rely on the manufacturer to uphold any access criteria to that PRV? So I think it definitely is an interesting route to explore. To the best of my knowledge, it's on the treatment side. It hasn't been expanded to diagnostics, but it's something that is worth looking into. But I would caution that anything that's front-loaded with the PRV comes with the access component at the end, and the guarantees and assurance that whatever's benefited from that PRV, whether it's financially, reselling it in the market, there's access terms baked into that in advance. So, would you like to say a few words?
Yeah, I would. And also, the problems with the PRV in the U.S. is they're not always awarded for true innovation.
Right.
So there's just a lot of criticism out there that, before it's replicated. But Ngozi, I had a question for you. So for pooled procurement, what has been the response from suppliers and manufacturers in terms of, okay, we'll get into this market if you make it easy for us. You aggregate demand for us. You, let's say, help us register, take off some of the burden on manufacturers to make it more attractive. So can you talk a little bit about that? And then secondly, what is the level of acceptability among governments, given that with the rise of regionalism, there is, the multinational strategies and solutions are not very attractive right now. But if anything could benefit from pooled procurement, I think it's NTDs, obviously. Right. Thank you.
Yeah, thanks. I'll start and then you can add. I think so just to kind of plug, we have a roundtable on pooled procurement that's coming up in about 3 weeks, I think. And part of the roundtable is to answer your question. So we'll have, manufacturers, countries, PDPs, and, NGOs, all different groups of folks that want to answer the questions about the challenges and the barriers to actually make this happen for NTDs. I mean, from what I'm hearing, I think it's really just about, even if you have the pooled procurement mechanism, and we're not looking at starting a new one per se, like for NTDs, I mean, no one's looking at like a global fund for NTDs. We don't need continued, first of all, a lot of people are not going to even support that. It would be very difficult to get that over the line. But there are a lot of existing pooled procurement mechanisms that could potentially be extended to include NTDs and other diseases. And I think what's missing there would just be the catalytic funding to ensure that that would happen. So I think that manufacturers would be more amenable to this if the catalytic funding were in place. And so part of our kind of core group is a group called MedAccess, which I'm sure you know about it, that works, that does volume-based,
Advanced market commitments.
Advanced market commitments, and also they also do the volume guarantees and things like that. And so we're looking at what MedAccess could help us with, but other entities that are similar. I forgot your second question, but I'll let you add on to this question maybe.
Sure, absolutely. I think with manufacturers, the perspective is if you can minimize the risk, you can work better, right? So I feel like if we're able to forecast better, if we're able to provide those regular order cycles, even if we say we're going to lose product, and that's okay, and product will expire and it will go bad and someone will have to pay for it. If we can get a minimum batch size for some of these diseases and ensure that the production is guaranteed year over year, then maybe it's worth it to do that, and that's okay, and I think it's accepting that and really taking out the risk for the manufacturers. I think that there's a lot of innovative sort of mechanisms or platforms that have evolved since COVID, one of them being AMSP, the African Medical Supplies Platform, another one, not to plug FIND, but DX Connect, where we're really trying to link the manufacturers with the buyers directly or through distributors if needed. And I think that the more solutions that make it easier to find channels for these products for buyers to buy, the better it is, because then we can aggregate the volumes, we can communicate that better to manufacturers, and we can organize ourselves better. So it's not, one country placing a larger order in April and then a month later a smaller country needs a certain amount, a certain quantity of medicines or diagnostics, and they've missed the production cycle and have to wait a year. So I think there's a lot that can be done with that. Wale, I see your hand up.
Just to add, because she answered the regionalism question, which I think you answered it very well. I would just add that, I think there are still some hurdles to getting there, which I think, the African Medicines Agency should help with, like, harmonizing regulations and things in the regulatory environment as well. But I think that there's an openness for this for NTDs.
Wale.
Wale Joseph from Market Access Africa. My question has to do with implementation. The places where you have many of these NTDs are, as you said, very remote, and it takes a lot of work to find patients, and you need to do repeated campaigns and so on. So even if you have diagnostics, and if you were able to convince Zydos to produce miltefosine at right quantities, how are you thinking about who pays for implementation? The governments, at least at the time I worked in NTDs, they have different, they have priorities that they need to deal with. So there's very little money there, and there's also very little money for access for NTDs. So how do you address that challenge?
Please. I think this conversation is a start. I think looking at the more innovative ways that are maybe going outside the traditional elements that we are used to could be a good way to start ensuring that access is part of any R&D conversation early on, that it's baked in from the beginning, that it's not a separate funding request or a separate ask from a government, after this wonderful RDT or treatment is developed, but that it's developed hand in hand. And there are PDPs that do, a great job of working in concert with the governments to make sure that it is part of the plan. But I think that we're going to need a push globally to be able to really make a difference. And with that, I'll turn it over to our resource mobilization guru to comment further on that.
I'm not sure about that, but I did have the pleasure to participate in some of the discussions of the group for quite a while. There's a couple of interesting things in NTD. So the group that brought together were groups that had benefited from a PRV. MDGH in Australia that were part of the WHO group that got the PRV. People like us that have been dealing with some of the mechanisms, people that were dealing with NTB, the fund that was there. So I think the bringing them all together, first of all, was interesting in NTDs is if you look everything in isolation, you will never solve the issue. What's interesting is when you look at test and treat options and when you look at NTDs, all of them have a pathway to elimination. And that means from a financing point of view that even if governments are not that willing to invest, the investment case itself can be made. And I think that's the point where we ended up. So for instance, we did look at all the different models. We looked at PRVs, but PRVs have their limitations. And interesting enough, even the group that benefit from the PRV are now starting to see that their funding are running out. Because yes, it is a lot of money, but that money also runs out if it only happens once in your lifetime. You cannot then end that. So I think the 4 that were selected, so the plug for the papers, I mean, the paper is actually quite interesting because it looks at the others and it looks at which are these 4 that we feel have a chance. Now, we do need to bring a group together to do this because it's not only about diagnostics. You cannot make the case for that diagnostic tool, for that one diagnostic company. It needs to be linked to the treatment that's in there. You need to actually make the financial case and then get the Ministry of Health on board. So it's not an easy task that we set ourselves, but it's an interesting one because we came to the conclusion it can be done. And weirdly enough, in NTDs, maybe the best case for these. And then finally, one thing is, let's stop calling it innovative finance. There's nothing innovative about it. It's been done for 150,000 years, just not in NTDs, not in global health. So let's just call it financing and find it a different way of solving it than through grant mechanisms that were used in the past. They can play a role, but they're not the only one. So let's not call it innovative.
Well, you were part of the group that decided on the name, but that's okay. I'm joking. But I just would add, I think we shouldn't dismiss domestic financing. There's quite a bit of work being done right now looking at domestic philanthropy across Africa. And, often we look at like Dangote and, Tony Lemelu, but there are a lot of businesses that are in Africa. There are small and medium businesses that can actually be engaged. So we really are trying to engage the private sector. And we saw this during COVID. I think AMREF, they had something called, I think it was like a COVID business compact, and a lot of businesses across Africa got together, and of course that's because COVID affects everybody. But I think, thinking about this for NTDs and, something that Dr. Sose, the WHO NTD director, says often is that we need to give NTDs higher visibility. There's so much overlap when it comes to NTDs and pandemic response. Like when you do case investigations, you can do the same thing with NTDs, it's just a bit slower, right? And so I think if something that GLIDE is really trying to do is increase the visibility of NTDs. And I think if we show that it's important for all societies, then we can probably get more private sector involved in this as well.
Okay, thank you. My name is Tapio Akuchinga from Patam. So my organization was involved in the development of the pool procurement strategy in SADC, the Southern Africa Development Community. So it's a very powerful document which actually showed that the region can save up to $4.1 billion if there's food procurement. But unfortunately, there was no implementation. And I don't think that, the appetite or the political will was there or is still there because, there is no implementation, as I said. So I just wanted to find out, in your initiative that, that you are implementing right now, Have you engaged African countries, and what is the appetite? What is the maybe the initial vibes, for uptake? Thank you.
Yeah, thank you. So two of the stakeholders, or a group of stakeholders within our group, is GHID and UNDP and the government of Japan, and they form what is called Uniting Efforts, which many of you may have heard of already. And Uniting Efforts has been engaging with endemic countries for, I think, the past 3 years, right? I think since 2020 or 2019. And there is an appetite. So not just for pooled procurement, because we talked about, the different mechanisms, but there is an appetite. But I think there is an appetite for pooled procurement as well. I think in some of our consultations, we spoke with, I think it was Tanzania, Ghana, and it was 3 countries, Tanzania, Ghana, maybe Zimbabwe actually. I think, again, a lot of digging to do. There's not just putting a Band-Aid on it. Like Zimbabwe, for example, has specific challenges because of the embargo, and it's difficult to include Zimbabwean regional solutions sometimes. But there is an appetite, and we'll learn more about, we really want to get to kind of specifics. So understanding, okay, do we work with, does the pilot start with the SADC region? Does it start with ECOWAS? Maybe there are different regions that it's going to be more feasible to kind of start pooled procurement specifically. Some of the other instruments that we talked about are really country specific, like debt swaps. That would be like at a national level. But there was a lot of interest to debt swaps as well. But the thing is, the interest comes from the health people, and it's not the health people that are creating these very complex government agreements, and we really need to get the finance ministers and other stakeholders involved as well.
Okay. So my name is Hun Sang-Lee from the RAI Foundation. Actually, RAI Foundation is kind of a sister foundation with GHID. And actually we also fund NTD diagnostic tool development. So we would be quite interested in joining the force together. Because we also always have to work together. So, but another thing is, so my actually two of the things that I was going to ask, I think it was answered about whether there is a mechanism for the advanced market commitment. I guess there is some of the work already in the process. Hopefully, something like Gavi. But secondly, also I was going to ask about what was the utility using of the COVID-19 experience where Africa had some types of pooled procurement experience, and what will be playing a role for the future product procurement mechanism. But I think it is already in the process. But my 2 questions is. One is, in the process of creating this pooled procurement mechanism in the regional level, what do you think is the role of the regional development banks? I mean, there is World Bank globally, but there is AFDB for Africa. Asian development banks, currently their health portfolio budget is half the size of the World Bank, even though they are only covering Asia. And there are development bank for Latin America and as well. So what do you see if the bank because they have the money and resource? I was wondering about their role. Second question is, when these kind of laboratory equipments are rolled out, one of the important aspect is quality assurance activities and continued supply of reagents sometimes for some types of laboratory diagnostic equipment, which also needs money. So getting the equipment to the older region and in the low-level health specialty is one thing, but find a way for constant, for the governments to have money and resource to do nationwide quality assurance activities. It is a hell of a challenge, actually. And without that kind of quality assurance efforts, sometimes there can be some inaccurate diagnostic result, which can be not helpful for these diagnostic accessibility arguments. Second is with the reagents. Getting equipment for one time is one thing, but having the budget for constant reagent supply. Sometimes it cannot be solved even by the funders. In that way, what can be necessary is having strong country commitment, at least for these reagents, to have some budget out of their own budget. But is there any kind of discussions like that?
Sure. If what's that? Okay, summarize the question. Okay. So there were 3 questions. Pooled procurement, I believe you are asking around if are there any existing mechanisms that are more owned? That's sort of what I heard when you were saying that question around how is that gonna and then the role of the development banks, yes. And then maybe, Willow, you want to tackle that question? And then the next topic was around the QA activities for diagnostics, also needing funding. And then how are we budgeting for the constant supply of reagents, as that's an ongoing need? So.
Thanks. And let me add, so there are 2 different questions. One of them is the role of the banks. I think one of the issues that we identified is that often we start these solutions, let's say, rather top-down. Especially here in Geneva, we have that tendency. One of the things that the development banks have very strongly said is it needs to be, I mean, they can only act when it comes up from member states and from countries. That's their development model. And I think when you think about these diseases, multi-country efforts, there's an issue with their model. So they find it hard to activate it in some cases. So I think what we felt was useful is sort of to create the model so they can buy into this, but they would need multiple countries to put in the request. So I think they are ultimately a target audience for these type of activities. But because they're fairly strongly focused on individual member country requests, that by definition regional requests or more global requests are slightly hard for them to mobilize around. That doesn't hold true across the board. It's not a given, but I think it's an issue. I think the second question would be a nice topic for one of our sessions in itself, because a very specific diagnostic nature. For the research that we did, one of the things we said is there's a whole range of issues, testing and treatment, the manufacturing component. The issue is breaking it up in smaller pieces, and especially in NTDs, is one of the issues why it's hard to mobilize funding, because it becomes a quite extremely narrow topic. And I think for a banker to respond to this, or for a financial institution, or even a grant giver or a philanthropist, knowing sort of like how the whole chain of activities is being addressed with impact as a result, is what we're really looking for here. I think they're looking at us to say, how are you solving quality assurance issues? And it's certainly a topic to have a whole 45 minutes on in lab cases. But what we're really looking at is here, how can we bring together all these specialists together? How can we bring countries together, which is was being addressed from the bubble already an issue in some cases, right? Even if you have a clear investment case. Then start working it down and saying, okay, so now how are we going to then break it up again into pieces that can be organized by specialists? I think that technical aspect, we know we have it. The issue is how do we bring it all together under one NOMA? I hope that answered the question a bit.
And just to quickly add on the last question around budgeting for reagent supply, I think that comes down to planning and market forecasting and being able to have that communication and open line between the funder, the manufacturer, and being able to plan that better than maybe has previously happened.
Yeah, I'll just add that I think this is about universal health coverage. You know, it's about universal healthcare systems, and it's, you know, yeah, I'm talking about NTDs, but NTDs really should be part of the health package. You know, we shouldn't, when we look at epidemic-prone diseases or we look at disease priorities, NTDs is nowhere. NTDs is not even in the budgets of most ministries of health, and you know, and obviously the diagnostics that we need for them are not as well. So I think, yes, there are special considerations. But there are budgets, there are plans, there are forecasting. There are facilities for other diseases. So I don't think this is something that is just so unique and that we're unable to really conceptualize how to do. We know how to do this. We need more investments in the systems and not just in specific diseases or even specific products, I would say. So I think that's another part to the answer.
So we're just about at time. I'm wondering if I could call on both of you just to have some final 30-second thoughts before we wrap up this session.
Sure. First, thank you everyone for attending today. It's great to see so many familiar faces here in the room, and I think that we talked a little bit around the importance of diagnostics, the importance of financing for diagnostics, and I think when you look at NTDs, there's a lot of work to be done at a holistic level, as Ngozi said, around universal health coverage and ensuring that we're taking an approach where we're looking at the whole perspective and horizon and not individually in different disease areas. So
yeah, I'll just add that a lot of the lessons that we've learned through our work together has come from other disease areas, and so if this is something that you're working on or interested in, I really appreciate the examples that you've talked about today, and also just learning more about the work that you're doing is important because we want to have obviously multi-sectoral, multi-stakeholders that are part of designing the solution. So feel free to come up to myself or Willow or Alexandra. I'll just volunteer them afterwards. And thank you, Find, and thank you everyone for your time.
thank you.
Thank you so much to Alexandra, Anson, and Ngozi.